Alright, well this is our last recording of the semester. I cannot believe it. Your papers have been phenomenally good. I am so impressed with what you guys have done. And I want you just to look back from the beginning in 2 short semesters how much you guys have grown in your ability to critically think, develop differential diagnosis, look for correct resources to find information. Just give yourself credit because you guys have done really well. I will go ahead and send out all the reproduction sheets, and they're very good. There's a couple of things on here that I did want to make you aware of. One of the things is testicular cancer. Now remember that this is a young man's cancer. This is one of the few young people's cancer. It's usually from ages 15 to 35, so make sure you're aware of that and how to do it, how to treat it, and well, not really treat it, you won't be treating it, but what to look for it, okay? Some of you guys have done beautiful jobs with pictures. There is one picture, testicular torsion, I believe it was. Very, very nice job with the pictures and everything else. So make sure you look at all these and just skim through them. And if you don't know anything about the disease process, just look at them real carefully because they are very well done. The big thing with the case study, this week's case study was a little bit more straightforward. He probably had BPH. But you have to also, anytime you're worried about that, you're going to think about things like prostate cancer and infection, which most of you guys brought up, which was great. Last week's SOAP note really was another example like the mental health one, where I want you to be careful when you're doing a SOAP note that you're looking at the whole picture. So we had somebody with type 1 diabetes who had it for a very long time, and they did have some end-stage type disease, the retinopathy, and they had some mild kidney failure. So their symptoms were probably related to that, but the number one thing you always got to remember is what can kill my patient. And remember, DKA can kill your patient. So if you're not thinking about it, you're not going to check for it. So you would eventually hopefully get a blood sugar when you got the lab work, but I don't want you to wait that long. Just get a real quick one in the office. So just kind of be aware of that. And there was a few people that got that. Of course, the depression one we already talked about, or this mental health one. We want to make sure that we don't let our patients talk us into diagnosis. We have to make our diagnosis. Matter of fact, at the conference that we went to last week, they talked about nurse practitioners getting sued. And that was one of the areas where nurse practitioners got sued. They tried to please their patients by providing the diagnosis that the patient had, treatment that the patient would want to live with, and when bad things happen, guess who they want to sue? It's, they're not going to say, well, I did this. Their reasoning, and rightfully so, is I expected my healthcare provider to know better and not let me do XYZ. So this is very important. Remember that, okay? So like I said, look through these sheets. Oh, one more other thing about the start of next class. If you look in the bookstore for the class Care Special Populations, it has all these books required. They're not required, okay? The book, you should have had a book list sent out by Jenny, and that book list is correct. So you need the Navigate to Access for the Women's Health book. I'm not crazy about the book, but it's kind of one of the better ones I found. And then the children's book, which is actually pretty good. The PEDS book is pretty good. So you might want to get that one. The other ones are potential things you could get, but definitely don't need to. The red book is the Bible of Infectious Disease for children, and it is actually available through the library. So you can, and there's unlimited copies, so anybody can get a copy of that one. So anyways, just kind of be aware of that going forward for this summer session. About half of you guys have taken the 3P test. I'm glad to say that at this point our class average is above the national average, which is great. And we've only had a few people take the final exam, but so far everyone's done well on that as well. So anyways, don't stress out. Hopefully get this one done, and then kind of relax and take some downtime, because we're going to be right back in it again on the 14th. Remember, you cannot start clinicals until class has started. Next week I am going to be out of town for the week, and so if you have any questions or concerns, please send those to either Dr. Snyder or Dr. Golden. I will try and check in with them, but I'm going to be out of internet range for most of my trip, I believe. Anyhow, I will see you again on the 14th, and I will, once I am back in town the next week, call me, ask me questions. I don't mind at all. Anyhow, have a good break. Thanks.